What's going on? Cystitis is driving me crazy. Where does it even come from? In their lifetime, every second woman gets cystitis. Modern medicine has studied the real causes of cystitis pretty well. In this video, I will show you two papers that prove 5 causes of cystitis for women under 40 and absolutely different 4 causes for women over 40. This is not just the research, it's the basis of the international protocol. What is the international protocol and why do we really need it? First of all, it's a 2,000-page book covering all urology problems. In fact, it's a collection of the world's best research done to study cystitis in our case. And the results are written as guidelines, basically instructions, mainly for doctors. That's why I chose to do a literature review based on the international protocol just for you. In the cystitis section, there are 215 studies were selected, and I will tell you about 2 of them concerning causes right now. The first study looking at causes and how often UTI happens in young women. There is a very telling graph in this article. Let me explain it. Vertical axis shows chance of getting cystitis during the life in percent. Horizontal axis is age. So we see that at around 16, there is a sharp increase in cystitis cases. By age 25, every third woman has UTI. By 40, it's every second woman. What happens at age of 16? Of course, the beginning of sexual activity. And talking about risk factors, the author put sexual intercourse first. Using spermicides, or actually any gels used during sexual activity, new sexual partner, specifically new, probably means some change in sexual habits. Mother had cystitis. It likely means some body features that run in families. And having cystitis as a child, meaning some physical or body structure issues that started in childhood. Obviously, behavior and sex habits are different for women under and over 40. Another study focused on women 40-65 years old. In this research took part 10 hospitals. This is really important for result quality and reducing mistakes. 9 clinics in USA and 1 in Israel. Interesting how this study was set up. Few words about that. It started based on positive urine test from a lab near these 9 medical centers. So they picked positive urine test from women 40-65 years. Researchers contacted the doctors who ordered the test to confirm the diagnosis of UTI. Then doctors contacted patients to ask them to join the study. Participants came in for detailed questionnaires. First results showed that in most cases the cause was Escherichia coli. That's a normal bacteria in our gut. Most common symptoms were frequency, pain, and urgency. And for specific risk factors in 40-65 age group, having cystitis in the past year. Urine leakage symptoms also connected to cystitis, taking antibiotics in the last 2 weeks, and getting cold. And finally, let me remind you about risk factors for women under 40. You can see that they're quite different. So these knowledge are very important for UTI management. So take care and keep in touch. See you next videos.